several interesting articles, one right on top of the other, that all kind of had the same theme, but different realms of attack. Joint pain and joint pain solutions having negative consequences. So both of them were talking about osteoarthritis, which is incredibly common. There are two treatments that are almost always suggested, and those are steroids and non-steroids. I was shocked by those two variations, but no, non-steroidal NSAIDs, non-steroidal anti-inflammatory drugs, right? And so the non-steroidal, those are like ibuprofen, right? Those are the common Aleve.
Yes, naproxen, ibuprofen, meloxicam, ketorolac is a prescription one, but the two over-the-counters, ibuprofen and naproxen.
Okay, those are the ones that I'm used to hearing about. And that makes sense. My joint hurts a little bit. I'm going to take an NSAID, ibuprofen, so that it doesn't hurt as bad. Okay. Steroids, what are we talking about here? What is the normal treatment process for joint pain? Let's say knees or shoulder or something like that.
Yeah, it's tough. I would say
you can do like a measurable dose pack, but I don't know that's how important that the specifics of it are really.
Okay,
it's just that you're bringing out big guns if you're using steroids.
Okay, so
there's somebody that has a disc. If like a disc issue came up, there's something going on low back specifically. Trying to get them out of a very acute stage of pain or osteoarthritic pain potentially.
Okay.
So little less. I would say it's a little less recommended at this point, but I would be remiss not to say we don't see it in the pharmacy.
Yeah, and some people need it. If you need daily use of a systemic steroid for osteoarthritis, I mean,
you're in a lot of pain.
Yeah, I feel terrible for you. Put it that way. Yeah, you're. So I would think that really who we're talking about here are the people who are just trying to get through their day, trying to get a run in, those kind of things, trying to get through their work day, those kind of things.
And then even just to exactly. A lot of times what you'll see then is since we were talking about steroids, you'll see more often corticosteroid injections.
Okay.
So that's triamcinolone injections. That's, oh man, I've been getting injections in my shoulders for 10 years, like that kind of stuff. That's often, triamcinolone paired with a local anesthetic, that kind of thing, which is very common.
And that's the idea being that the steroid helps to reduce inflammation so that there's less pain?
Definitely, yeah.
Okay, so this is the normal process we're talking about. These articles...
opioids, there's even now topical anti-inflammatories that are available over the counter now, so... Good and bad options there, yeah.
So that's what is normally prescribed or recommended. But these studies that we're seeing are suggesting that may not always be without consequence. One of these articles said a group from the University of California enlisted 277 people to participate in the study. This was a study on NSAIDs. The parties suffered from moderate to severe osteoarthritis in the knee. Participants had also been using NSAIDs for at least 1 year, so they'd been using them. In addition, information was examined from 793 people who also had the disease but didn't take any drugs. At the beginning of the study, the group conducted MRI scans of the participants' knees and followed up with more scans after 2 years had passed. The inflammation of the joints, which is the problem in the first place, is the inflammation, as well as the quality of the cartilage, was, quote, worse at baseline in the participants taking NSAIDs compared to the control group and worsened at 4-year follow-up, unquote. Now, I'm no doctor, but if you're taking an anti-inflammatory every day, it could be because you have a worse case, right? Why would that not be the assumption?
Yeah, that's a good point.
But the really relevant part is that 4 years later, their situation was even worse than the control group.
Yeah, because we have to remember too, what's happening is, the anti-inflammatories help, but what's happening in osteoarthritis is the breakdown of cartilage. So that disease process is not stopped by anti-inflammation.
Got it.
Do you know what I mean?
Yeah.
You can always think of and there's more nuance to it, but in general, you can think of osteoarthritis as wear and tear.
Right.
It's wear and tear. Now, there's a little bit of a paradox that if you don't use it at all, like if you say, well, I have mild arthritis in my, and Dante, I'm sure is going to get to this, but if you have mild osteoarthritis in your knee and you say, well, I'm not doing anything anymore, I'm not biking, now you want to take some of the pressure off that joint. Maybe you want to bike versus run.
Right.
Maybe you want to power walk, you want to row or power walk, those kind of things versus, things that are pounding like running, but you want to keep using it so that the body, I don't know what the exact mechanism is, but you want to make sure that the body is still trying to protect the synovial fluid and trying to keep that area, usable functionally as it is essentially being worn down. So I don't know what Dante's thoughts are about the study itself, but to me, it wasn't that surprising because I may not even really totally linking it to the use of the NSAID. I'm just thinking, it's been a while and their cartilage is getting more and more worn down.
Right.
Whenever I think of the problems with oral NSAIDs, I'm thinking more systemic problems. I'd like to see what happened to these, people potentially their kidneys.
Yeah.
Cardiovascular events. That's what I'm more concerned about whenever somebody comes in and says, that they're taking Aleve ibuprofen every day.
Yeah.
So,
man.
So there's a couple different ways to go here because then you've got the, injectable corticosteroids.
Yeah, that's the other article was saying that that injectable corticosteroids was effectively having the same issue, that they were doing follow-up studies and people who had been having the injections were having worse outcomes years down the road than those who didn't.
I think that's a little different.
Okay. Fill me in.
Yeah, doing those steroid shots right to the site has shown to break down the cartilage in the area. It gives you a tremendous amount of relief.
Yeah.
But doing those shots directly to that area has shown you can get relief. 7 days? Takes up to like 7 days to work. You can get relief for a couple months. But especially if you get them repeatedly, that you can definitely that's been out there about that. That's corticosteroids, hyaluronic acid. There's still some controversy over how much safer that is, but that is kind of like the synovial fluid. That is like a precursor to cartilage. That does take longer to work, up to 4 weeks to work. It is often not covered. It's pretty expensive, but it does usually last a little longer, maybe like 3 to 6 months. So two different things here going on with osteoarthritis. What are you doing orally?
Right.
There's overlap with steroids, and what are you doing to the site?
Well, okay, then help me out here. So if there are downsides to everything, but I still want to be able to walk or play tennis or whatever the case, play piano, do the things that I need to do, I don't feel like getting injections into my knuckles. That sounds like a bad idea. What should I be doing to maintain movement as long as possible to the greatest degree possible?
Yeah, so a lot of what I'm about to say is kind of like one of those it's easy for me to say kind of things.
Sure.
But ultimately, I think it still starts with the belief system. And so, like Joey mentioned, we've been hearing this narrative, whether true or not, or partial or nuanced or whatever, is the whole wear and tear idea. So, like, I don't know what you necessarily call it, because when you look at X-rays, that's what's ultimately kind of shown.
Yeah.
The issue with that is there's a high percentage of people who have the same looking X-ray as somebody. So they have two people. They both have, let's say, wear and tear. There's degradation of the cartilage in the knee. One group has symptoms, the other has no symptoms. So you're always left at sort of this pivotal point.
Right.
Like, is this all true? Or is this just like anything, a massively complex, disease, disorder that is, there's societal, psychological beliefs.
Sure.
There's obviously a physical component. So it comes back to the very inception of that causal belief, wear and tear. Oh no, it's bone on bone. That does not sound good.
Right.
The last person I heard with bone on bone ended up having a knee replacement. Oh no, I have vulnerable joints. Oh no, I'm going to avoid activities. Surgery is my only option. And that's just again, it's easy for me to say, but that's like the quick and dirty of sort of what happens here. It's like, I'm just sitting here deteriorating. And if I exercise, I'm going to cause it to deteriorate faster. And if I don't exercise, I'm
right.
I'm going to deteriorate as well. So trying to move people away from that narrative is huge, and that's number one. It's
so you're saying mindset is enormous in this.
It is mindset. There's no way to out mindset your. I woke up and my knees are bothering me. It hurts to get out of bed.
Why would I want to go ride my bike? Do you know what I mean?
Yeah.
That's why it has to be. Even that's why I said it, but I knew Dante would take the reins with it. But like, that's exactly what you have to do. That's one of the key things to getting your knee at least feeling better is to, now again, no running, but walking, but biking, swimming. That's a critical thing. But it's a paradox because in your mind, why do you want to use the thing that hurts?
Right.
Yeah.
My knee hurts. I've been told it's wearing down. I saw this X-ray. Let me go move it around.
Yeah.
And work with it. I see why.
Yeah.
There is a mindset issue.
Yeah. Yeah, it's tough, and nobody's really to blame. Again, you look at some of these changes that are on X-rays, or you've talked to an orthopedic surgeon or whatever. It makes complete sense. I mean, the proof is sort of in the pudding with what you're seeing. But again, we know that with how complicated symptoms can be, and who's having symptoms, who's not, different management and such, that it's another one of those things that's you have to take such a holistic, such a holistic approach. And so what you're ultimately doing is trying to find, as the individual, find the right entry point to moving around. I mean, it could literally start from sitting to standing.
Yeah.
And that's a test that they'll use clinically to kind of see where, maybe assess somebody's fall risk or see what kind of progression they're making in occupational therapy, whatever. You're just trying to find that entry point. And then, and as you go, you try to find the upper limit, not pushing things into it hurts so bad I can't move, or I'm not gonna be able to move the next day. But if it's somewhat tolerable and it's not, you're not, totally debilitated the next day, that's a positive, and you start to combine those small wins day after day, week after week, and you're pushing the ball down the line as far as when you thought maybe you were going to have to get surgery, when you're going to have to get the joint replaced, all that kind of stuff. So it's finding the most tolerable level of symptoms and doing your best to not catastrophize or be fearful of those symptoms.
Yeah.
Again,
Yeah.
it's like, I mean, in a very terse way, you have to kind of believe like, I'm not really making this worse. And we know that. We almost know that for sure. Unless you're driving things into painful, compromised positions, generally speaking, you're hard pressed to think that you're making it worse.
So long as you're not experiencing serious acute pain, you're probably helping. The discomfort is okay. It's pain that's bad. Okay.
Yeah, along those lines, especially when you're talking about knees too, because that's still a major one. It's the age-old, weight.
Yeah.
Losing some weight is going to be critical. And if you can incorporate that with the physical activity, obviously losing some weight in and of itself is going to help as well. Just straight physics.
I know a lot of physical therapists I've heard repeat the phrase often, motion is lotion. That's what you're talking about. Just keep moving. It'll keep things going.
Yeah.
And then it's just, this is going to seem like totally out of the blue, but life stressors, poor sleep, anxiety, all those other things. Like people think that that's just like my pain, my chronic knee pain, my chronic back pain, the chronic arthritis in my hip. This is one box.
Right.
This set of issues, the anxiety, this whatever this classification, and my high blood pressure, all this kind of stuff. This is another box, and then this down here is in another box.
Right.
And what I do to have fun, this is in another box. Well, guess what? It's all fluid, and all of those things, your beliefs, all of this kind of stuff is playing into what maybe this disease process kind of looks like for you. And so even for myself with training, it's like I've had a couple knee injuries. It's like I'm on this. I felt it when I was 22. I guess I'm on the fast track to a knee replacement. It literally crossed my mind.
Yeah.
And it's just kind of this, not that you push yourself inexplicably, you just want to start to question some of the feelings that you might have towards something like arthritis.
Right. Because the instinct always is, as soon as you feel a twinge of pain, stop doing the thing, whatever that is, right? When you touch the stove and it's hot, you pull your hand away. Don't touch the stove again. If, gripping the golf club makes your knuckles hurt, then don't touch the golf club again. And that's not necessarily the right thing to do. In fact, in a lot of these situations,
Yep.
it's the opposite.
And it's not just a feeling. I mean, these things are so ingrained.
Yeah.
You heard it from a coach when you were 10. Then you saw your mom get less active into her 40s.
Yep.
And then you saw grandpa in his 70s not throwing the ball with you anymore. I mean, it's literally everywhere.
And
It's you don't even have to be consciously aware of it. It's all there.
And if weight gain is an issue, a complicating issue on top of this, then it makes sense that the less you move, you start gaining weight. It keeps getting worse. It's a self-fulfilling prophecy. In
I've
some
got
sense.
this bad knee.
Yeah. Man. So the bottom line here is there's issues with all of these major treatments. Nothing is perfect.
Yeah.
But the best thing you can do is keep moving. And anything else? I mean, any other lifestyle changes or supplementation? Anything else?
Supplement-wise, quickly, back turmeric again. We're going to hit that again.
Yep.
Great anti-inflammatory, and fish oil.
Okay.
So keep it simple with those two.
Okay.
Yeah, at least 500 milligrams twice a day on the turmeric.
Yeah.
At least maybe even like do 2 of those capsules twice a day to start. And then at least about 800 or so once a day on the fish oil. 800 to 1,000 twice a day.
Cool.
And then even though we kind of touched on some of the negatives of the different treatments, we know that using ibuprofen, Tylenol, all that kind of stuff they provide sort of transient benefits at best for some people. That's okay. If specifically, let's just say you're like, I want to try something less invasive, less side effects, less whatever. I'm going to go for the topical steroid instead of the oral steroid. Let's just see how this works. If that means if you're going to walk for 20 minutes more than you have, or go to the gym for 30 more minutes, or start doing something, and that helps you do what you need to do to start the process, they're there as tools.
I was just going to say that makes a lot of sense.
The topical NSAIDs are a great option, I think. It's just a really nice way to get that NSAID to the site. Because remember, we're still not certain from the article that it's the anti-inflammatory that's degrading that joint.
Right.
So if you get some NSAID to the site via like a diclofenac or a Voltaren to the site. We even do like some specialized pain ones in our compounding lab, but you can get a Voltaren over the counter. I think that's a great option. And then, if it's once in a while, you maybe overdid it, or maybe it's just a real bad day, or whatever the case may be. It was Thanksgiving and you were carrying your grandkid around all day, whatever. Yeah, take an ibuprofen that day. It's not like, those things aren't the end of the world, but have the turmeric and stuff on board if you don't want to touch it at all, or have the turmeric and omegas on board ongoing,
right?
Then maybe you can take that ibuprofen or Tylenol a little less.
These articles are not to say that you shouldn't do these things. If your doctor's talking to you, it's not an option. It's just to say there are downsides. Do the things you can do without getting into that to the greatest extent possible. But the point is to live longer, better, right? So moving and doing it makes sense.
Yeah.